Usually when I am in some countries and give talks about certain things, I usually start this with good morning, good afternoon, or good evening. But I know that you're located right now and coming to this webinar from different corners of the world, and you have different time zones. So I cannot say that. In any case, I strongly believe that we are very fortunate and lucky to have the technology to put us together and to be able, through this technology, to exchange ideas and talk to each other, even in this very difficult time when COVID-19 is terrorizing the humanity. I have to admit that the idea of this webinars have not been mine since November 2019, when we launched the CyberPatient product. Many of my colleagues and friends have asked me to give more information about CyberPatient and how to use CyberPatient for their students. And also, I have been not only asked for these webinars, but also I made these webinars on the basis of very good feedback from our friends and colleagues around the world. I have to admit that the first good feedback we got is from Aga Khan University. Our colleagues and students have given me an outstanding feedback on the use of CyberPatient. And many of these issues that we are going to discuss are based on some of the issues that they have brought up. And the students and colleagues from the Aga Khan University in Pakistan have been led by my friend and colleague, Dr. Sadaf. And I like to just cordially thank them, especially for giving me a very good feedback on the basis of which we are making these webinars. As it was mentioned by Aitan, we will have 4 webinars and each would have a specific topic. The first topic for today is the introduction to CyberPatient, and the next topic would be CyberPatient design, and after that, curriculum integration, and is what we have done so far for CyberPatient research. By the end of this talk today, you will have an understanding of the gap between theory and practice of medicine. You will have the understanding of our solution and a little bit of CyberPatient history, definition, goals. But the most important issue we discussed today is the educational philosophy behind CyberPatient. So by the end of this talk, you would understand the educational psychology theories behind CyberPatient. So as part of the problem, we all know as pedagogues and educators that there is a huge gap between theory and practice of medicine. This cartoon on the side here symbolizes medical school, and people are sitting there learning things. And then the other part symbolizes the hospital where they practice. And you see there's a big gap, and some people fall into the gap. Some people have difficulties crossing that gap. So our solution is very simple. We would like to build a bridge between theory and practice of medicine, which is symbolized here in this cartoon, when you can see from the university student can walk into the cyberspace, learn about practice of medicine in the cyberspace before they enter into the hospital. So we have created a clinical environment in a cyberspace that simulates a real clinical environment where students can gain practical experience. To tell you a little bit about the history of CyberPatient, CyberPatient was conceived as a computer-assisted instructions in 1995. And by year 2000, we were able to build the first prototype of CyberPatient in a CD-ROM. The reason we did it in CD-ROM because at that particular time, the internet was not strong enough, the bandwidth was not there to carry the load of CyberPatient through the internet. And also, we did not have sophisticated internet languages such as HTML5, JavaScripts, and others. Therefore, we made it in a CD-ROM, but it was very difficult to reproduce, to multiply, and to distribute CyberPatient. In the interactive activity was very limited. In 2015, the University of British Columbia Industry Liaison Office approached me and asked me to bring this innovation once again into the light, because they believe that that we have now the internet languages, we have the bandwidth, so we can build a better CyberPatient product for our medical students. And we have taken that opportunity and built the CyberPatient and launched the platform in November 2019. So by definition, then CyberPatient is an interactive online platform designed to simulate patients in the full continuum of care and provide assessments of the learner in a clinical environment. And our goal is to enhance compiled thinking through experiential learning and support competency-based education in a virtual clinical environment. And now we're going to discuss how we're going to do this. To do that, we're going to go back into classical medical education. We have specific methods in classical medical education, which is mainly chalk and talk, which is lectures, seminars, and talking to students, reading books and giving assignments to the students. And the third one, which is the most important one, is a see one, do one, teach one, which some of my friends call this see one, do one, kill one. But in any case, let's see how these methods are working so far. If we shower students with knowledge all day long, do they learn anything? This question was answered by a cartoon. When the student is coming home in the evening and the father is asking, did you learn anything today? The student says that they don't give us time to learn anything. We have to listen to the teacher all day. And that's the true story. However, aside from these anecdotal issues, research in national training laboratories in the United States have shown that the knowledge retention after 3 months for a lecture is only 5%. If you read a book, it's 10%. If we add audiovisuals, it's 20%. If we provide a demonstration, it's 30%. A discussion group would increase it to 50%. But so far, the best method to teach students and to have a long-term retention memory is practice by doing. It's learning by doing and teaching others. Which brings us to the same question of learning by doing. The question of learning by doing was conceptualized by a theory of constructivism and social constructivism. Theory of constructivism was proposed by a pedagogue, a Swiss pedagogue, Piaget. What Piaget said that learning is secondary to and dependent upon progressive reorganization of cognitive function. To teach, Piaget said, is not to reshape a behavior, but to provide the environment for self-exploration. So we construct our learning by doing things. The Russian pedagogue, Vygotsky, also a very famous educational psychologist, agreed actually with theory of constructivism proposed by Piaget, but he added, and he said that human beings are social creatures. They learn from each other. Therefore, the constructivism has to happen in a social environment when people are interacting with each other. Now, CyberPatient is a build based on the theory of constructivism. We provide the environment for the students to self-explore. And also because internet is nowadays becoming the biggest social creature in the world, so the students cannot interact only with their classmates in the classroom, but they can interact with other medical students all around the world. So we are bringing this theory of constructivism and social constructivism in by bringing CyberPatient into the internet and in social relationship of students around the world. But let's think about something else at this point. The $100 million question is, how do competent clinicians use their knowledge to arrive at diagnostic and management decisions? How do we make our clinical judgment, our clinical decisions? Research published in academic medicine have shown that we are making our clinical decisions mostly based on 4 types of thinking. It's reduced thinking, dispersed thinking, elaborated thinking, and compiled thinking. Reduced thinking is based on empty mind. If you know nothing, but you like to say something or make a decision, that would be obviously wrong. Dispersed thinking is when you have a little bit of knowledge here, there, but you cannot connect the dots together. Therefore, you have a clustered mind, and when you make a decision on the basis of this type of thinking, of course, it would be wrong. So we don't use, actually, we discard reduced thinking and dispersed thinking in medical education. But what we use is elaborated thinking that is based on deductive reasoning. So what we teach our students in medical school and residency training program to be a good deductive, to how to get the information from history, from physical examination, from lab tests, from consultation and other advices, and how to put those facts together to come up with a logical, a reasonable clinical decision. However, elaborated thinking takes a lot of time. It takes hours for a student, or maybe sometimes days in the beginning, to come up with a clinical diagnostic or management decision. However, when the students are graduated and they're going for practice, within 3 to 5 years, they can see a patient with 5 minutes, 10 minutes, and they will make their clinical decisions. And it's not because we are ignoring or we are not considering patients, the important issues. It's because we are switching from elaborated thinking to compiled thinking. Compiled thinking is based on recall, recognition, memory. And this was conceptualized by Hafdings, and Hafdings' theory of transfer of learning. At this point, it's important to understand that there is a difference between transfer of learning and transfer of knowledge. Transfer of knowledge is from one person to another person, where, for example, right now, I'm talking to you, I'm learning from you, and you may learn something from me. We are transferring knowledge to each other. However, transfer of learning is from the same person to the same person, how knowledge and experience is moving from the same person to the same person. It means how our prior experience affects our present and future experiences. So according to this Hafting theory and transfer of learning, the more we practice, the more we repeat things, the more we have in our brain imprints of those exposures to those conditions or to those tasks or to those competencies, so that one day, after repeating many times, we become an expert in that competency. So this competency-based education is based on transfer of learning. That's why the CyberPatient that is designed is based on this theory of transfer of learning. So students can practice in the cyberspace the conditions and the tasks and the competencies so many times so that they have a good a print of that competency, so then when they go to the clinics, they transfer that knowledge and that experience and that competency into the practice of medicine without any problem. So if you go back to the classical pedagogical methods of see one, do one, teach one, which is the best one as we discussed before. So we know now that experiential learning that would improve our transfer of learning would increase our compiled thinking that would positively affect our practice of medicine. But what are the problems and obstacles? The problem, the obstacle in medical education is that we don't have always patients available for students to give it to them. Patients are not coming because I have a student, they're coming because they're sick. So maybe there would be a ethical and legal issues if I gave a full opportunity for a student to interact with patients and make clinical decisions. So therefore, what we do is we make it very slow. And as you can see this curve going up, we're taking the hands of students, we're giving them little by little the opportunities to make decisions, and we are always supervising them on that. And that would make medical education very inefficient. We need 3 years usually in the residency training program to come to a point that we can say to a resident, now you're a chief resident, you can make your own decisions, you go ahead and work independently. So in this way, that we are presently in a classical mood is functioning, so our medical education have certain issues such as safety issues, ethical issues. It's very costly, it's time consuming for the faculty and for the students and for the system. It's less perhaps efficient, and it's not reliable because we cannot teach all students the same patients because we don't have the same patients all the time for every rotation that students are coming. Now, if we modernize this theory of see one, do one, teach one, and integrate simulation with CyberPatient in it before they do one, so they have to see one, then simulate CyberPatient in a cyberspace with CyberPatient or other technologies out there that are giving competency-based education, and then do one and then teach one. Then what will happen is that this simulation with CyberPatient or CyberPatient-like simulators can improve actually experiential learning and compiled thinking that would support our practice of medicine. So if we do this, then what will happen that then with the CyberPatient or CyberPatient-like competency-based simulators, we could decrease actually the time of training, and we will make it more efficient, more reliable, because you can give any patient at any time. It would be less costly for the system and for the universities and for the faculties. It would be more ethical and safer if the students are practicing their competencies in a virtual environment that doesn't harm the patient before they touch a real patient. So to have some conclusions or some summaries from the pedagogical values that we described, well, we can clearly say that CyberPatient is a student-centered environment that students can go at any time and any place and practice as many times with the same patient, with a variety of patients as they want. It supports the competency-based education. It improves the decision-making abilities of the students. It improves the experiential learning of students. Actually, it condenses the experience of 3 years or 4 years to much lesser time, because with us, as you know, when we are going through the full continuum of care of a patient, it might take days or months for us. In the hospital, it might take days, but in clinics, it might take months to do all the investigations and everything. But here, the students can go through all those experiences within 15 to 20 minutes and gain more and more experiences on how to make decisions in a safe space. It accommodates style of learning. We will talk about this maybe later on, but as you know, about 20% of the population are very good learners, and they can learn from book, from lectures, from anything. But however, the other 70% of the population requires a specific style of learning. Somebody is good with visual, somebody is good with tactile, somebody is good with audio. So CyberPatient is providing opportunity for all style of learning, and also the interactivity gives more the students, more opportunity to students who may have a little bit of problems with analysis synthesis. We also can claim that it improves compiled thinking and provide solid base for transfer of learning. So in this lecture, I believe I don't want to talk too much about things, because any of those issues that we talk, I can talk, hours on them, and we may, if you want to do in the future. But I wanted to keep this very short so that we can have more time for questions and answers and discussions, because I have to learn from you actually more than I can give you. So in summary, we can say that CyberPatient is an interactive online simulation platform that simulates continuum of care. It's very important to say that, because there is not a lot of technologies out there that simulates the continuum of care. There's a lot of technologies that simulate the point of care or specific tasks or specific conditions, but to give the a simulation for the continuum of care, we certainly don't have a lot of those. There are some maybe, but there's not a lot. And CyberPatient is designed to fill the gap between theory and practice of medicine. So is if that is what CyberPatient is designed, then we can conclude very easily that CyberPatient does not replace any other method of learning. CyberPatient is not there to replace lectures. It's not there to replace patient care in the clinical environment. CyberPatient is just a bridge between theory and practice. It's an additional tool to support your students and faculty to manage your educational process and to give the opportunity for students to learn better. So today we have like about 120 CyberPatient cases that are based on MCC, Medical Council of Canada, learning objectives. And it is our basic platform. Having said that, we are in the process of preparing and launching many more outstanding advanced technologies, such as EPA's Entrustable Professional Activity Assessment tools. We are in the process of developing an online team training tool. We are automatizing the creation of CyberPatient so that that professors in any part of the world can go to the internet and actually build a CyberPatient with their recent experience in clinics and give it to their students within perhaps half an hour. So at this point, I would like to thank everyone for listening to my boring talk, and to I'm looking forward to having your questions. Aitan and Sam are there assisting me on bringing your questions forward to discuss further. Thank you.
Yes, thank you very much, Dr. Karim. If anyone has any questions, like I'd mentioned at the beginning of our webinar, make sure to type in Q&A. You can type in your question, or you can raise your hand and we can ask you to say your question verbally. There is one question that I'll answer right now from Krishna, and I'll answer this live. The question is, who is the audience and from which country? So our audience right now is for healthcare professionals, doctors, medical students, and we also have them from many different countries. We have over, I would say right now, 20 countries that we have emailed to be able to be part of this webinar. So that's to answer your question. And the second question is going to be answered live by Dr. Karim. The question here is by Mohammed Baraka, and he's asking, Dr. Karim, was CyberPatient developed for medical students only?
Okay, so just to add for what Aitan said for the first question, we are now, in this webinar, we're from 20 countries, but CyberPatient is now distributed and used by 108 countries around the world. And we have contract agreements with more than 28 countries around the world. Yes, CyberPatient is for everyone. And we would like to use CyberPatient as mean of equalizing or bringing the North American standard of education to developing nations. This is one of my dreams, and this is going to be serving that purpose. To answer your other question, Mohammed, yes, at this particular time, CyberPatient is made for medical students and interns. However, we have heard from many nursing schools that they have tried CyberPatient, and they believe that it would immensely help the nurse practitioners programs in their school. So we also are planning to have CyberPatient for Residency Training Program. Also, we are trying to gamify it for K-12 students in the public. But for residency training program, it would be mostly on the form of a entrustable professional activities. And we are working with the Royal College of Physicians and Surgeons of Canada very closely to support and develop such program for residency training program.
Great. Okay. Mohammed also had another question here, which I believe you touched upon right now, Dr. Karim, but maybe even for the future, the question is, do you have similar platform for pharmacy students?
We have been proposed by a professor of pharmacy from Calgary, in Canada, to develop such a program. But at this time, we don't have a specific program for pharmacy. However, the treatment part in the management part of CyberPatient will be very useful for pharmacy students.
Okay, great. I have here a hand that is up by Omar Eladil Hamid. So I'm just going to see here, I'm going to allow him to talk and see if he'd like to verbally ask you your question. Go ahead, Omar, if you'd like to ask your question.
Still, Omar is muted.
Okay, I will ask to unmute.
That's it.
Talking is permitted.
Yes.
Okay, thank you very much. I'm Dr. Omar Al-Adil from Sudan, physician neurologist by profession, medical educationalist, International University of Africa, Faculty of Medicine. First of all, thank you for this nice presentation, Dr. Karim, and for the Can Health as well. My question in short, and thank you for offering CyberPatient to low-income countries like Sudan and other countries. I know this is the first webinar among 4 other webinars. If my question can be answered later, I don't mind to postpone your answer, Dr. Karim, Professor Karim. My question is, you know that in International University of Africa Faculty of Medicine, we are adopting the system of integrated curricula, where we have an integration between basic and clinical from the early semesters up to the last semester. And we adopt as well the problem-based learning and the team-based learning. So how CyberPatient can be beneficial for students at different stages? I know you know that at different levels, some students might have just exposing themselves to the basic, and then they apply basic, and then whenever they go to the flagship, then they get into the real scenarios.
Yeah. Thank you very much, Omar. I can partially maybe answer your question and refer it to maybe a later and our third webinar. We were going to talk more about this. But to answer your question very briefly, yes, CyberPatient is designed in 4 different levels. Each level corresponds to the year of, to the clinical years for different universities. Because people have variety of curricula, we could not make this to be adapted only to one curricula, even to North American curriculum. But what we did is made it flexible enough so that it could be integrated in different years of medical school for different levels. And we do believe in stepwise progression of students, and we strongly recommend so that students in different levels, from whatever level they are, when they start CyberPatient, to start it with level 1, which is only history taking, and then when they perfect that, to go to level 2, which is history taking, physical examination, and then to level 3, where diagnosis and management decisions are made. And level 4 is actually for internship. The difference between level 3 and 4 is that CyberPatient is based on 3 mistake rules. So if you make 3 mistakes in level 3, the CyberPatient platform would allow you to move forward, but taking into consideration your mistakes and giving you feedback on those mistakes later on in the end. But in level 4, after 3 mistakes, it would be disrupted. So it looks like you are now ready for practice. You cannot make mistakes. So the platform would turn off. So we will talk about this curriculum integration later on next week, perhaps next Tuesday, I think. I hope this was good enough to just give you an introduction on what's coming. Thank you. Aitan, other questions?
Yes, so now we're going to move on to the next question here. This is by Tara Shalal, and her question is, does CyberPatient include using avatars?
Yes. I think we are in the process of introducing avatars in 2 different ways. One is the voice control of avatar inside the cyberspace, and voice control of the whole CyberPatient, and that is coming very soon. Where right now you have to click in order to move things around and to make actions and interactions. But soon we're going to have an environment where you can speak actually to the patient, to the avatar patient. You can speak and they can answer your question. The second fully avatar-based technology will be the team training that we do in emergency or trauma situations where where the team is working together. So that technology is also developed and it's in the process of being completed. Yes, that's the idea.
Okay, great. Next question we have is by Susan Ahmed, and she asks how student progress is being monitored.
So the student progress is monitored in the end by students, because CyberPatient is designed originally as a self-directed studies. So in the end, we have a dashboard for the feedback dashboard that would give the student a feedback on what are the questions that he or she asked, and what are the right questions was supposed to be asking. What are the physical examinations that they choose to do, and what are the physical examinations that they had to do? What are the same thing like lab tests that they choose to do in comparison to the one that they had to do? Same thing with management, daily management, and everything else. So that comprehensive machine feedback, machine learning and feedback is in the end. So what it means that we have an intelligent tutoring system sitting in the back of CyberPatient environment in the platform. So when you start working with CyberPatient, that intelligent tutoring system is gathering all the information, and later on it brings to you and given to you in the with comparison to the gold standard. What did you do wrong and what did you do right? So the next time when you come, you learn from your mistakes, and when you repeat this 3 or 4 times, then you will come into perfection. So the evaluation, the assessment is done on 3 indicators. It's knowledge, it's time, and it's cost, because we believe nobody teaches cost of healthcare at the universities most of the time. Not every university, but most universities, because it's not our mandate. But when the students go to medical practice, they're not very conscious about the cost. So what we would like to do with the CyberPatient to bring the consciousness in around the cost of healthcare, so the students would know. So those are the kind of feedback that we gave at this time. It's machine feedback. However, as I said, it was in the beginning designed as the student-centered. But as I said, we have had a lot of outstanding feedback from a lot of people, including the Aga Khan University I mentioned before, is that what about the teacher? If I wanna, as a professor, as a teacher, as a dean, as an educational body, would like to be in control of the educational process. So bringing the control from only from the students to the faculty, we have done that. In the beginning, we were trying to do this, but then we thought maybe the students would like to learn by their own, so we did that. Now that the faculties are interested around the world to do that, we are planning for the next version of CyberPatient to have a faculty dashboard where faculties can actually assign assignments, one case or many cases to one students, or one cases to many students, or many cases to one students, or many cases to many students. And then also to monitor their progress. So the progress would be monitored not only by the student, but also by the professor. We will finish this perhaps by September this year. We're gonna have the second version 2.2, where we are gonna implement all these feedbacks we received from everywhere around the world. And at this particular time, if you're a faculty member and you would like to be, you would like to monitor the progress of your students, what you can do in the meantime is to share the password between you and your students so that you can actually see the dashboard of your students. But also, the students could take a snapshot, a screenshot of their feedback screens and send it to you so that you can evaluate and assess them on that basis. Thank you for the question.
Okay, great. Next question up we have is by Hadia Azami, and she's asking, is there any possibility to lower the cost for medical students from some developing countries?
Yes, we are. It is my dream, it's my vision to support the developing nations with no cost, not reduced cost, but no cost. I'm working on that very much, and trying to find mechanisms to do this more efficiently. But we are at this point in contractual agreement with some of the universities in Afghanistan, in Ethiopia, with all medical schools in Ethiopia, and the International Medical School of Africa in Sudan, where Dr. Umar was talking. And we do have, no, this is, I am from a developing nation originally, and my passion is to bring the state-of-the-art technology to those kids around the world who cannot afford it. But there are other issues and problems with that I am trying to overcome, like internet accessibility. In many developing nations, again, the rich kids might have an access to the internet, and the poor kids may not have access to internet, and it's going to be too costly for them to have access to internet. And for me to bring this to the whole country free, again, I'm supporting the rich in that developing nation, but I'm not supporting the poor kids. But my heart is there. My heart is with everyone, but more with those who cannot afford it. So I am in the process of solving these technological issues and logistic issues to support developing nations.
Okay, great. And I guess it would be a good note to let all of our webinar attendees know that at this time, CyberPatient is free of cost, in case they don't know. To be able to access CyberPatient right now during the pandemic, you're able to use CyberPatient at absolutely no cost, even, and of course that includes developing countries. You can go to our website to be able to sign up for access. And the next question do we want to elaborate on that, Dr. Green?
Oh yeah, I wanted to also say that a lot of people have asked me what it means, the end of pandemic. It will be tomorrow or a month from now. For us, the end of pandemic is when the United Nations says there is no pandemic issue anymore in the world. Then we are going to turn this from fully free to different methods of compensation and support.
Exactly, yes. So CyberPatient is free of charge right now. So go ahead and try us out and let us know what you think. Our next question here is by Juan Pablo Nihenda, and he is asking, are you planning to create CyberPatient in Spanish?
Yes, that's a very good question. I think our next business decision would be to, and we are planning to translate CyberPatient not only in Spanish, but in many other languages, such as French, Chinese, Japanese, Persian, and others. It would have a lot of financial consequences for the company and so on. So when the time comes, we're going to do this. However, with our Japanese partners, we're in Kochi University in Japan, where we do some research and their students are fully using CyberPatient for their studying. We translated actually 3 cases into Japanese just for them to do their research. And to our surprise, it was much easier and less costly than we thought before. So the opportunity is there. We will do that. I believe we will use our partners in different parts of the world with whom we have signed contracts to translate CyberPatient into different languages. But it will take time. It's not going to happen tomorrow.
Okay, great. So next question we have that I think you just answered in the fact that CyberPatient is at no charge right now, but this is by Krishna. And she's asking, can we get the demo copy of CyberPatient?
A demo copy?
Mm-hmm. Demonstration. And we do have a tutorial on the website that you can elaborate upon.
Yeah, but we, I think we don't have a demo copy at this time. The whole CyberPatient is a demo. If you like to go and register, you can use the whole CyberPatient. But as a demo, we got this, again, it's built based on the feedback we got that a lot of people actually cannot use properly CyberPatient because it's a very complex interactive platform and you have to be trained on it. So at this point, we are in the process of finishing an interactive tutorial, which would be a demo. So by the end of next week, it's going to be up, perhaps with all these seminars that we have. All these seminars will be up on the internet, but also we're going to have that interactive case on the internet so that students can go without registering or anything, can go and just learn how to use CyberPatient and demo for themselves.
Okay, great. Next question we have here is Gahala, and she's saying or asking, We are doing an integrated system. So if we are teaching cardiology, for example, can a student at this use it, for example, only history?
Yeah, you can use only history. If you go to level 1, you'll have only history, nothing else. You can choose cases for them and tell them to go and choose level 1 and do those cases. Very easy.
Great. Next question we have here is by Hassan El-Bari, and he is asking, to what extent the quality of CyberPatient could reduce medical errors and how to get constructive feedback?
It's designed to reduce medical errors, and we hope it does, but I don't have hard scientific data yet to present for you. CyberPatient is just 5 months old. So that impact has to be measured scientifically. That's why we have all the contracts with different prestigious universities to actually do this kind of research on the impact of CyberPatient. I cannot give you at this time any concrete number or how much and how it would affect, but we certainly believe that improving compiled thinking and through experiential learning would improve the decision making of a doctor, a student that's a future doctor. So hopefully there's going to be less wrong decisions when they are in real practice. That's the whole idea. But we are going to do the research. And there was a second part of his question.
Yes, the second part of his question was how to get constructive feedback.
Yeah, so the feedback it can be in 2 ways. One is the machine feedback that the students are going to have by themselves anyway, and you as a professor would be aware of that. But the second feedback is by professors. So once you see their dashboard and you see what they're doing, then you can go there and say, "Wow, I think you don't know what you're doing about physical examination. You're weak on history taking. You cannot make the right conclusions. You have to practice more this or practice more that." You can give those kind of feedback directly to your students. Having said that, we have the Intrustable Professional Activity CyberPatient, the EPA CyberPatient would have a totally different way for feedback. There would be a machine feedback, and also we use artificial intelligence to compile problems in solutions through machine learning and also through algorithms. But the APA, CyberPatient APA would also have the opportunity, because it's an assessment, it's an exam for the professors to evaluate and assess their students more rigorously.
Okay, next question we have here is by Nasdar, and they're asking, is there a chance for a student at the end to repeat a case?
Yes, they can repeat a case 100 times, 1,000 times, as many times they want.
Okay, next question here is, do you see any role of CyberPatient in summative assessment of medical students in present COVID pandemic, as direct contact with real patients has now become difficult?
Yes, we believe that would be a very useful, CyberPatient would be a very useful tool, not only for summative assessment, but also for formative assessment. I think we're going to talk about this more in detail in lecture 3, which is going to be next Tuesday, on the integration of CyberPatient into the curricula.
Okay, next question we have is by Azmat. When somebody logs in any way in any part of the world and practices CyberPatient, your center head office gets information about that person who was online and can evaluate how his knowledge or so. I'm not too sure what that question is asking.
I know what it's asking. So no, we're not. I think the knowledge and experience of students are assessed by themselves. It's in the system. They can see that. We do not see that in the back end. We could if you want to, but it's not our objective. But we see, we can analyze things like to support maybe the medical school or the student. We could analyze how many people hit, which cases are most be used, and how many times one case was used by one person or two people, things like that. The statistics that would be useful for us to modify the system and make it more friendly and more useful to people, but also for the faculties to understand more about the teaching process. But the immediate and direct feedback on the three things, as I mentioned: knowledge, time of completion, and cost of healthcare, would be directly given to the students at this point, that the student can share with the faculty. And within maybe 2, 3, 4 months, we're going to have the dashboard for the professors who could directly monitor their students.
Okay, great. Now we have a two-part question by Nazdar, and the person is asking, is CyberPatient free for students and faculties? And do you have any plans with Iraq?
At this time, yes. At this time, it's free for faculty and for students. I don't know. We have a criteria for developing nations. At this time, it's free for everyone. So Iraq is not an exception. Of course, it's free for Iraq as well during this pandemic time. But our criteria for giving it free to countries is the GNI. GNI stands for gross national income. This is the United Nations indicator that identifies developing nations from developed nations. So according to GNI, United Nations indicator, if the GNI of a country is less than $4,000 per capita, that country considered to be a developing nation. So I do not know at this point if Iraq is what is GNI of Iraq, but I don't want to say anything about it. But if it is less than 4,000 per capita and is recognized by United Nations as a developing nation, you will have it for free.
Okay, our next question is a question from Omer, and the question is, how does the internet type and speed affect CyberPatient? Is there any part of it that can be played offline?
The speed, yes, that is a very big problem. The speed internet accessibility is a huge problem in developing nations in particular. We are trying very hard we are aware of that, and we are trying very hard to overcome that difficulty for developing nations. And as I mentioned before, I elaborated a little bit on this issue, that the first solution that we have in our mind to bring more servers in different parts of the world close to Asia and in Southeast Asia, so in Africa, so that that the speed that is lost within time of accessibility would be reduced. But also, we would like to develop some technologies that would create a local area of network where the universities can actually have CyberPatient through that technology distributed, in the campus in the radius of 3,000 by 3,000 meters to students in a high speed. But at this point, yes, we know that downloading CyberPatient in some countries, particularly those countries whose internet is blocked in general, or not blocked, but the firewall is very thick. They have a lot of difficulties in accessibility, and they use VPNs. And when you use VPN, then it's possible to download, but it's very slow. I don't want to name countries, but in some countries we saw that it is about 3 minutes to download a case, while in North America it's 40 seconds. So we are working on that to improve that for Africa and Asia.
Okay, and that is the last of our questions in the Q&A section. If anyone has any more questions, you can just quickly jot them out my way. I believe there were some questions in the chat box that Sam has already answered. But if there's anything else, we can just wait another a minute or so. And then other than that, I think we're good.
Yeah, no, I think it's good with timing. We did very good for the first webinar. We did good with timing and with our function as a whole. So I would, in the end, like to thank everyone again for coming to this webinar and for giving me the opportunity to talk to them. And I hope to see you guys next week, or this week actually, on Thursday, where we're going to discuss the usability of CyberPatient, because a lot of people have difficulties on usability, and we use again the feedback received from our partners to actually explain how to overcome those difficulties for accessibility. And I think the one issue that somebody brought up is very important. If they can ask somebody else to join, yes, please go to the more people join this, the more faculties are participating in this, the better it is for you. So call your friends, families, colleagues to participate and to learn more about this new technology that's out there. Thank you again.
Great, thank you. Bye now.
Bye.